Thank you very much, Sahani sir. Good evening, good afternoon, and good morning. This is the 1601st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Riji Rasheed from Kerala. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy has comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have an international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again, and you can subscribe the same without paying any money. And you can share it with your friends. And if anyone don't know about the link, you can search IFBH Homeopathy at YouTube, so that you will get the videos, previous videos also. And let us come to today's program. As you all know, today, Dr. Riji Rasheed, she has completed a BHMS and is the chief consultant at Dr. Riji's Healthcare Katakada, Trivandrum. And she was a former state project coordinator of KSYC. And she has more than 14 years of clinical experience, and she has presented several sessions in our forum, including in English as well as in Malayalam. All these sessions were brilliant, and she is a classical homeopath practicing in a better way. So let us see what doctor has to say about the Andropause homeopathic journey. That is something different. That's a rare journey. Let us see what are the things there in the journey. So we proudly welcome Dr. Riji Rasheed to this session. Welcome, doctor. Your co-host, you can open your video first, and then you can. Yes. Please adjust your camera. We can see you. Please adjust your camera a little more. Yes, now it's quite clear. Yes.
Good evening, all, and I hope all are fine also. Today we are going to discuss about Andropause. So, as sir has been, excuse me, let me share the screen, okay?
Yes. Please adjust your camera a little more so that we can watch you in a good way.
Okay, definitely. Is it okay?
Yeah. A little more, adjust. Little more. You can watch your face in the screen itself. Oh, okay. Now it's fine. Okay.
Yeah, okay, so fine. So, Andropause, that's our today's topic, okay? So all of them are very well aware about the menopause and its journey, then perimenopause, menopausal stages, and like the whole things. Like the same way, male health is also important. Sir, am I audible?
Yes. Yes, you're
Okay,
on.
okay. So like the same way, male health is also very much important. Being a male, his potency, that is sexual desire and the whole things in the whole journey, everything is needed for his normal life. Okay, so many are facing these andropause issues, but no one is aware of it. Knowingly or unknowingly, they are facing all these issues and they are thinking that it happens to me only. Why it is happening to me only? Like that, they are thinking. So scientifically, we have to do a look back around all these things. Okay. Before going to andropause, we have to know one thing, that is andropause doesn't mean that it only creates sexual problems. It doesn't like that. See, andropause, that is testosterone diminution, will cause so many problems. Okay, if that person he is already diabetic, he is prone to cardiovascular diseases. Like the same way, his mental health will be deranged, his quality of life will be deranged, and so many things are there. So it is very important and a vital one in a male's life, that is andropause. So it is known as a late onset of hypogonadism or male menopause. It's a medical condition characterized by a decline in testosterone levels in older men. This decline can lead to various physical, emotional, and psychological symptoms. So, as we are practicing doctors, we might be knowing that not only means that sexual problems will come to persons after crossing 40s or 50s. It doesn't mean like that. Nowadays, sexual problems will patients will come to us from any age groups. Okay, whether it is married or unmarried, or having a single partner or multiple partners, that is not an issue. So many cases are coming, and we are getting that is masturbation issues, and so many are getting. Okay, so this is this decline. In this case, andropause, that is when he crossed to 40s or 50s, he'll feel all like things. So, when a patient, that is male patient in this age group, is coming to us, we have to take care of his mental symptoms. We have to take care of his sleep routine, all these things. Usually, in chronic case takings, definitely we are looking all these things. For each and every case, being a homeopath, definitely we are looking all these cases, all these symptoms. But in the case of this andropausal issues, means sometimes we not be directly getting this andropaus. We don't get patients, that is nobody will come to us and tell us that, like, I'm having prostatitis, or I am having urinary complaints, or I'm having increased sexual desire, but I can't do anything, or that parts are cold and relaxed. Nowadays, I'm not active like previous. Like the same ways, we'll get cases, but no one will come to us like, I'm having andropause, so you have to give me the treatment for andropause. Like that, it will not come. Maybe because of the unaware of this hormonal imbalances. And secondly, what I have to tell you that before the class, I have updated the poster. Okay, including doctors. So many are asked me that, what is this? This is for the first time. We are seeing this andropause. Can we do it in homeopathy, or normal ones are asking that. So is it a term like menopause for men also? So first time only we are hearing about this. Okay, so andropause typically affects men between the ages of 40 and 60, although the onset may vary. Then it is not an universal experience. And around 2 to 5% of the men is going to affect like this. Okay, so this andropause, which leads to serious increase in the serious health conditions that definitely impact a man's quality of life. So, osteoporosis, type 2 diabetes, cardiovascular diseases, all these conditions will increase the risk of the disease. Like I said earlier, impact of the quality of life is very important. It will create a low esteem, like anxiety, depression, like that. It affects the physical health also. So, causes. The causes of andropause are multifactorial. That is, it includes aging, then testicular dysfunction, hypothalamic pituitary gonadal axis dysfunction will be there, chronic illness, that is diabetes, obesity, something like that will be there, lifestyle factors, poor diet, lack of exercise, all these things will be there. Nowadays, when patients are coming to us, whatever may be the disease, they need only medicines. Okay, they don't want to exercise, they don't want to change their lifestyle disorders, or they don't want diet. Even though we are providing diet, what are the things you have to do, what are the things you don't have to do. If we are preparing a chart, whether it is online or offline, we are giving also. They are not at all interested in doing all these things. They just need me. They just needs medicines and they need instant results only. Okay, many
But
patients came to us.
you can share the screen. You are co-host. If you have the screen to be shared, there is an option.
Oh,
You can do.
I thought it has been shared, sir. So it has been not shared.
Yes, you can.
So actually, can others can see the slides
No,
or not?
no, you have not yet shared. Have you shared?
Yeah,
You
I
you
thought.
may you may withdraw the same, and then you can upload it again so that it will come.
Yeah, I will upload it again. Okay, I'm extremely sorry. So I thought that you people are watching. Okay,
No,
let me.
we people are watching. You can also watch from the side. Uh, so
Okay, so I have to withdraw the savers, right?
yes, you just
Yeah,
withdraw
I
it.
opened,
Then
but I can't.
you just stop screen sharing, and then you upload it again.
Okay.
There is at the center part you can see.
Yeah, it's okay.
Then you no, it has not yet come. You just stop screen sharing and restart again.
Wait. Then we have to restart it again, right?
Yes, you just reshare it once again. There is no
Sir,
problem in. uh,
can you please share it from there?
you may.
Send.
I shall ask someone to do that.
Yeah, I already sent you.
But the thing is that you have to give it to my mail ID. Dr. Danish, DRDHNESH. Then
No problem. We'll continue the session, sir. No
uh,
problem.
that's good. That's good. No problem. Next time you can try next
Yeah.
time. During
Okay, I'm really
during
okay.
our session, you can study the same by doing. Okay.
Okay. So,
Mm.
so I'm really sorry for the inconvenience happened. Okay. Always in the case of my classes, these technical errors are nowadays usual.
No, no,
So,
it is not alone with you. Since all beginners have this problem. No problem. Anyway, yeah, we can. Your presentation is really going into great height, so you can just go ahead in that way. There is no problem in screen sharing because all people are uh, doctors and only very few homeopathy lovers, so that everybody can understand what you are telling. Okay,
okay, sir. So
be
actually,
be little bit patient. You need not to hurry in a way. You just control yourself and then go in a slow way. That's good. So
okay,
that if
because this is a vast topic, that's why in my during my classes, after the class,
it is a big one, we can divide it into two part and then go ahead in some more presentation in the February. No problem. Don't be
okay,
so that those who watches the same can understand really what it is. Okay.
okay, sir.
Presentation is
I,
really you may go ahead.
okay. So actually, what will happen is the first and foremost in the case of mental complaints or the physical ailments or emotional complaints for us, so they'll come to us and they might be gloomy, okay, and they'll tell, doctor, I have two children and we both are government employees and we are doing the best, okay, in our life, but I don't know what happened nowadays. I can do the whole things properly. I have a short-term memory, and so I'm short-tempered also. And I'm thinking that actually what happened to me for some days because I have everything, but I'm not at all happy like that. They will express to us. So we have to take their cases, and we have to ask intimate questions also without hurting their self-reliance, we can ask the whole things, so including the sleep, including the sexual history, and the whole things we can ask to them. So the common symptoms of andropause includes that is low libido. If they feel that we are going to help them, or we are not teasing them for the actual reasons only, we are asking all these things, definitely they will reveal to us the whole thing, definitely they will reveal to us, but we have to take care of something, two or more points. Firstly, we don't have to tease them. If they are telling us that I am having low libido, okay, so we never might feel like that. Oh, I'm a lady doctor, okay. You can't tell me like that, or I'll arrange a male doctor for your consultation, like that. Some persons will come to us, even though they are knowing that we are lady doctors. They will come to us, and within a shy, they will express like this, doctor, I am here, but you are a lady doctor, because they are already knowing. All my dear lady doctors, we have to note one thing, that we must be very bold enough, and we have to answer, we have to hear very pleasantly all those symptoms. We don't have to show any gestures or any insecurities. We can ask the whole things, okay. So in the case of andropause symptoms, low libido is there, erectile dysfunction is there. So if they are explaining, we have to be clear about all these things, whether what are the symptoms of masturbation, what is low libido, then what is uh, erectile dysfunction, what is premature ejaculation, and the whole things. And being a homeopath, we must know about the medicines also. So what are the low libido medicines also? What are the symptoms included, both mind and physical symptoms in Agnus cactus? What is inside the caladium? What is inside the ashwagandha? What is inside maca roots? Like that, we have to. What is inside damiana? Then only we can differentiate both in the both aspects, we can differentiate these things, okay. So in the case low libido will be there, erectile dysfunction will be there, excessive weakness or fatigue will be there, and weight gain will be there. In the case of weight gain, that is weight gain in two types, will come. uh, on the pot bellied or belly fat will be there, like the same way their chest, that is boobs also, it is increased, okay. It is just like gynecomastia in their 40s or 50s. In some patients, it will be like that. That thing also create, because they doesn't want to go outside. If somebody is teasing them about all these things, their body shaming will be there. So we have to give them the reassurance, okay. So we have to give them not only the medicines. First and foremost, I have to tell them that is, not only we are giving medicines, we are giving them counseling. We are taking a proper case taking. We are giving them counseling. We are giving them assurance. We are giving them medicines. We have to offer them a mind cleansing letter. That mind cleansing letter is very important, okay. Not only to this type of patients, whatever the patient is coming to us with chronic complaints, and they are suffering for so many years also, we first and foremost, before taking our medicines, we have to teach them how to write a mind cleansing letter, and we should never have to read it, okay. They have to write. If us also, we have also some emotional problems. Someday we are happy, someday we are sad, someday we feel jealousy, irritated, all these things will be there. Mind cleansing letter is like that, whatever the things I am remembering, okay. Some persons might be in the past, they might be insulted me, I might be angry in some situations. I can answer the whole things happened to my life till this day. I have to write. So while writing, sometimes I feel headache. So during for writing this mind cleansing letter, sometimes we feel headache, sometimes we feel irritated, sometimes we will cry. Whatever it is happening, that should be written. Okay, after writing this letter, please ask the patients to read once more, and they have to destroy it. Whether it that they doesn't want to show that mind cleansing letter to us or to anybody else, because that is their own life and their own secrets. Okay, everybody is having their positives and negatives, so they have to keep it and they have to destroy it. So first in these type of cases, monthly twice we can ask. Later we can ask for monthly once. So the next is loss of muscle mass will be there, muscle wasting will be there in this patients. Then they will feel relaxed and lack of strength will be there. Then bone density loss will be there. Like the same way, mood changes will be there. Definitely they will have low self-reliance, and it will make them as anxiety patients or depressive patients. Okay, all the depressions in our society is believing that depressions will mostly come due to the problems with the partners or problems with the economic problems like that. No, it will come in these spheres also. In some cases, they don't know how to express all these things to anybody else because of the self-reliance, because of the self-esteem. So how can we, being a patriarchal society, unfortunately, because we believe that for a man, okay, irrespective of the caste, creed, religion, or age groups, whatever it is. So it is a proud for him that I can do all these things properly. Whatever his age, he believes that it is my pride that I can do all these things properly. In the case of when infertility cases are coming to us, in that cases also. Well, during the couple visit, where if we are asking about this sexual history, what they will tell us, doctor, I don't have such problems, but don't know, we don't have children. Okay, so we are asking about the sexual history and all the things also. They will blindly answer that. Some persons will they will have slight anger also. They will answer that, no, 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 doctor, that's it like that. I'm doing the whole things in a better way, but don't know what is happening. Okay, so if he's waiting outside and we are asking his wife, I think in this 14 years, about 75 percentage of the wives, they are answering us that doctor don't know what happened. He's not doing anything. While I am insisting for doing this relationship also, he's asking, he's blaming me, he's scolding me, and he's asking me that, do you want it every time? What is this? You are a lady now, you have to cover all these things. Why you are telling like this? For a child only, during the fertile days only, during the fertile days, while doctor is insisting them, and because of my pressure only, they are doing all these things. So in that infertility case also, they are thinking like that. So we have to handle a little bit carefully while asking all these things without hurting the self-respect is very important. Otherwise, the patient will not come to us. Definitely they will not visit us. Not only visit us, if you are seeing outside, somewhere outside in mall or movie theater or something like that also, they will not talk to us, or they will not show a at least they won't show a familiar face to us also. So next is sleep disturbances and cognitive decline will be there. Then the symptoms of andropause. So we have explained about the low libido, that is decreased sex drive, and they have an interest in sex, but unfortunately they can do. In the case of conium also, they have an interest in sex, but they can do. In subcellular also, they have a desire, but they can do it properly. Then erectile dysfunction, that is difficulty in that is then erection will be there, will be difficult. Then fatigue, that is they are sluggish and they are lacking energy. Weight gain, muscle loss, all this is. Then emotional and psychological aspects, mood swings will be there. So their partner will think like that, what happened to this man, because he's not like this before. Okay, he was so kind, he was so jovial and trivial to me and to my kids and to my family members, but don't know in these days what happened. Because usually husbands, what majority of the husbands, what will they is, they will show a in a because they will show a hatred or lack of interest to the sex from the very starting initial stage. When the wife is trying for a sexual relationship, from the initially they will cut off it. Okay, they never reveal that because of my low libido, or because of my sexual erectile dysfunction, or I have this problem. That is why I'm avoiding this. They will not show like that, but they will find so many other reasons before night, in the evening, or from morning itself. They show because they want to abort it. They don't want to do it. Okay, because they know that they are not they are incapable for doing all these things. So definitely they will find some other reasons to cut short it. So we must give an awareness to their wives that your partner is having such a problem, so we have to give some more time, like that. Okay, next is loss of motivation is there. That is there because they are reduced in interest in activities, hobbies, or work. That is they feel that I'm being purposeless. They don't, I don't want to do any purposes. Okay, because he feels that why I'm living like this, I don't want to live like this. Okay, so we have to motivate them in whatever the way. We have to motivate them. Next is cognitive decline will be there. That is, they can't concentrate in anything. Earlier they will be the best in their industry, or they will be the best. They will have the sharp memory also, so they cannot concentrate anything like the same way. They have memory loss will be there, anxiety will be there, and their hormonal aspects. What will happen is, as we know that during the menopause, estrogen is decreasing, like the same way. So we'll have hot flashes and all the things. That hot flashes is same similar to the male also. So hormonal aspects, testosterone will be declining. The primary hormone affected in andropause, leading to various physical and emotional symptoms. Here also estrogen, increased estrogen levels in these persons can contribute to weight gain and breast tenderness and other symptoms like most of the females are before 2 days before their periods or during their periods, they don't want anybody to touch them. Okay, if children also, yesterday also one case came that husband complained me that if children is coming to play with the wife, that time also she is telling, she is going, is trying to avoid it. Okay, that is not because of the dislike to the children. While I was talking with his wife, actually she's having periods. Okay, so she's having breast tenderness and pain will be there. If anybody is touching, obviously she'll feel pain, and fibromyalgia is there in that case. Like the same way for males also, during the andropausal age, or after they are crossing 40 50, in this times they'll have estrogen dominance, and the breast tenderness and pains, swelling, all these things will be there. Then growth hormone. In these in cases, growth hormones levels will be decreased, and it will contribute to the muscle loss, bone density, and other associated symptoms will be there. Then behavioral symptoms, that is social withdrawal. It is very dangerous during this time. In this age, social withdrawal is very dangerous. Because they don't they want to be alone, they want to sit alone, they want to avoid all the community activities, and they wishes to be in a quiet room. Okay, like they are in their increased anchor for everything. They will start shouting. Okay, then other symptoms, that hot flashes will be there for the like the females. In males also the hot flashes will be there. This hot flasher, in sometimes the whole body they will feel like that. In sometimes the testicles or testicles only, or in the penis area only it will happen. Okay, that hot flashes, that is not only the internal hot flasher will be there, externally also they will feel, not only they, if their partner is while they will also feel this hotness. Okay, so next is night sweats will be there. That is excessive sweating will be there. These night sweats, that is excessive sweating, will not make that patient, will make that patient to wake up because he can't sleep like that. Then decreased muscle mass. Actually that is the muscle strength will be day by day it is losing. Okay, then risk factors. uh, as we know that after crossing 40, uh, our health starting to decline in nowadays because of their bad lifestyle disorders, and after taking so many steroidal steroidal medications. Like the same way, nutritional supplements we are taking, and in this type of patients will be coming. If 10 patients are coming, 4 or 5 will answer like this: I have this problem, but I'm using a spray, it will make for the time being it is making clear, okay. Or I'm taking oil, or I'm doing something like that, they'll tell, okay. So we have to make them aware about what are all the side effects while taking all these things. Before we are giving medicines to these type of patients, we must be aware that no such medications are taken, like Viagra, such like medications are not. We have to stop them, all these things. We cannot take these two type of medicines at a time. So if we are taking our medicines, you have to take our medicines only. Then we have to give them an aware that we are not giving any magical remedies. We are not offering that within 5 days or within 2 days or within 7 days we are going to clear all these things. We can say like that. It depends, as we know that it depends on the patient only. So next is, so if a patient is coming to us for these type of patients, their comorbidities must be watched. If they are having cholesterol, hyperlipidemia, whether it is total cholesterol or LDL or triglyceride, whatever it is, we need to be that should be in a good control. Like the same way, if the patient is having diabetes, there also some patients may look after only the HPS or PPDS, something like that. So HbA1c must be watched, and we have to give them an awareness about this the relationship between diabetes mellitus and the sexual functions. Okay, so there we have to give. Then like the same way, if they are having prostate problems also, so there also we have to give an awareness. So whatever the complaint, if possible, we can take a take an USC abdomen, that is no for accessing the accessory diseases. Okay, if we are clearing the whole all these things only, we will attain a result. Otherwise, what will happen is the patient will come to us and explain all these things, and we are knowing that he's having andropause symptoms, and we are, after the thorough case taking, we are selecting a medicine also. But at the same time, the patient must be taking allopathic medications or ayurvedic medications, or some other natural remedies or something like that, for his kidney stones, or for his prostate complaints, or for his jaundice, or for his or hair problems or something like that. Some steroids will be taking, or blood thinners were taking. So they might be having going some surgeries will be there. So we have in our case takings, we have to take what are all the medicines they are taking, and what are all the surgeries they are undergone in the childhood, whether they have realized or they became affected with mumps or something like that. The whole things we have to take in test. Then diagnosis and treatment. As we all know that hormonal assay is important in nowadays, whether it is male or female. For many sort of complaints, hormonal assay is needed. But unfortunately, what will happen is our homeopathic doctors, they will think like that. They are not even paying to us properly. Then how they are going to do all these costly tests? So the scenario has been changed nowadays, but in some places it is happening like the same way. So if we are doing all these things, it causes a huge amount. So how they will handle all these things? It is not like that. It depends on the result only. You can give precise medicines to them. Okay. So blood test measuring the testosterone levels and other hormonal imbalance must be maintained. Like the same way, we have to do the physical examination. It is mandatory and necessary. So while doing the physical examination, kindly note that if female doctors are there in clinic, in most of our the clinic hours, we might be alone. Then staffs will be there. If staff is there, it's okay. If they are not there, kindly not. If we are doing physical examination, there must be an extra person with them. Okay, if it is her wife, if it is his wife, it is okay. Otherwise, there accompany somebody else. So it is mandatory. So we can tell to talk to them. You can come the other day. I'll give an appointment, and on that day we can do all these things. Then secondly, if we are doctors or not, so we are females, so we have to understand one thing. We know that a person sitting in front of us, if he is really affected with the disease or he is pretending to be, so we have the ability to know all these things. Okay, so if it is like that, we have to eradicate them. So we have to stop our consulting there, and we can deal it very properly. We don't want to shout. Okay, we don't want to create any problems. We just ask them. So we can give SL or something like that. If we really want to avoid for a single piece of SL, also for a single powder also, you can ask, you can charge as per your interest. Okay, they will not come again. Then is give respect and take respect is very much important while handling all these cases. Then next is test options for androstenedione, that is treatment for androstenedione, this andropause. Other than homeopathy will definitely we will discuss. Other than homeopathy, we can go for TRT, that is testosterone replacement therapy. Like in females, they'll go for estrogen replacement therapy. In males, that is testosterone replacement therapy. Then lifestyle modifications like diet, exercise, stress management, all these things are there. Then medications for specific symptoms in homeopathy, not only in homeopathy, in every system, because it's a nowadays this is it's a booming industry. Okay, we can't imagine, because if a person is making an advertisement without just one or two sentences needed and a phone number is needed, a person are behind all these things, because they will come and tell, I purchased an oil for 3,000, that is from online. I applied it, but no relief. So many quacks and frauderies, adulterant things are happening, and crores and crores of rupees, that is turnover is there in this sexual sphere medicines in our country. Not only in our country, in the globally, this is a mostly wanted one. In the ancient times also, this type of treatment was the mostly wanted one. So we have to explore the potential in this area. That is the main important thing. Without using any oil, without using any spray, without using any cream, definitely we can treat it beautifully, and we can handle all these things so nicely. Next is then homeopathic rubrics. So we have to take some rubrics for the class for the handling all these things. First and foremost, in this, other than sexual spheres, we can definitely take over the anxiety. You can take over the anxiety. So for anxiety, while we are searching, argent nitricum, aromat, lycopodium, it will be coming like that. Then depression also, aromat, calcarea carp, lycopodium will be there. For the irritability, mainly lycopodium, naxvomica, and I am not discussing about the whole sphere of rubrics. Whatever I am using only, I am discussing about. That is lack of confidence. Certainly, they will have a lack of confidence. For the lack of confidence also, lycopodium, argentamide, and gelcine. Lycopodium, if we can't understand the whole things, and we are in a trouble, what to give? Okay, at the at the same time, definitely we can give either lycopodium or naxomica. Definitely they will get a small action will be there. Along with this lycopodium or naxomica, blindly we can give damiana. Blindly without the symptoms also we can give ginseng, ashwagandha, all these tinctures we can give. Then memory loss, for memory loss, ginkgo biloba can be given. Phosphoricum acidum will be given. Again, lycopodium is there. Lycopodium is important and vital. Okay, we can give it in 0 bar potencies or 30 or 200, 1 or 10 about 10 I have never used till 10 only I have used. So we can use all these potencies and beautifully it will create. But with placebos only we can administer all these things. Otherwise, whatever we are explaining to the patient, they will not be happy. Okay. Then for the mood swings, we can use pulsatilla, sepia, lactasis. Hey, hello, we are discussing about male complaints only. Then why we are thinking about pulsatilla or sepia? No, it's not like that. Pulsatilla and sepia works very well in male complaints also. While we are using, we can see the marvelous result. Like the same way for the restlessness also. Argent and nitricum can be given, Singamet can be given, and lycopodium can be given for the restlessness. Okay, then uh, so I forgot one thing. So Andropause, that means andros in German means sorry, andros in Greek means that is human male. Okay, pause we know that it is a cessation. So it is not German, it is Greek. Andros, that is it means male. That is the meaning. Okay, male, human male is the meaning. Then Andropause diet. We'll definitely go to the medicines and we have the diet. So diet is very important and supplements is very important. But before prescribing or we are suggesting any supplements, kindly note one thing. Some supplements may create problems to their earlier problems. For example, without the knowledge of a physician, or if we are prescribing or not in social media while we are scrolling in the social media, for even a single hair fall also, they'll tell that vitamin D3 you have to take, EV1 you have to take, omega 3 fatty acids you have to take, Singovit you have to take, like that they will tell. So for example, if a patient is having renal calculi or gallbladder stones, all these things, that patient must not have to take vitamin D3. That is mandatory. So, like the same way for every supplements, if here also for andropause also, if we are discussing about the supplements, they are also we must be sure that these supplements will not cause any problems to their comorbidities. Okay, so ashwagandha is always our best one in this type, not only in this type of things. If we are thinking of a tonic, definitely we can give ashwagandha to anybody. That is a gift to homeopathy. So ashwagandha can be given. In supplements also ashwagandha is there, not only in our homeopathy. Then vitamin D can be given. Then garlic can be used. DHEA can be used like the same way. Pine bark extract can be used, L-arginine can be used, and Passiflora incarnata. Our Passiflora incarnata is that is there. Chrysin is there. So definitely in another section we'll discuss about these supplements and homeopathic relationship. Okay, all the supplements we are taking outside from the market, definitely it is there in our homeopathy also. Then is diet. Okay, diet also we have to mention them that they have to take fruits and vegetables, and especially the colorful fruits and vegetables must be there. That is the antioxidants are there. In our Indian diet. Especially in our southern side, because for each and every curries, each and every dishes, they need red chilies or pepper, or because they need spices every time. Okay, so in these type of cases, hormonal imbalances patients are coming to us, or hair problem patients are coming to us, whether it is a male or female, we have to suggest them about capsicum. Capsicum is in, I think it is green is there, red is there, and yellow is there. Okay, if they are using capsicum for all these preparations, it will give them the better result. Okay, then whole grains must be brown rice, and unpolished brown rice is always the best. So if possible, kindly maybe whatever may be their hormonal imbalances, if possible, we have to advise them to take these whole grains. Then lean proteins must be taken. Meat, they can take meat, but if possible, we have to advise them that kindly take grass feed. Okay, from the non places, if we are purchasing from the non places and we might be knowing that they are grass feed, then it is okay. Then they can definitely take fats also, but the fats must be came from the healthy sources. That is very important. Then omega-3 fatty acids, we are blessed with seafoods. Okay, then if there are any persons having an absorptional problem only, they can what to tell, if their body is not absorbing properly only, they can opt for these supplements. Otherwise, we can use fishes like salmon, then mackerel, sardines, tuna, like that. If they are vegetarians, they can take chia seeds, flax seeds, hemp seeds, all these things. While taking these seeds, we must be aware, we must know one thing is this, for mostly persons are using these seeds for reducing weight. Okay, so if they are taking much amount, it will cause gastric problems to them, it will cause constipation to them. So depend on their need and quantity only they have to take. We must give them, otherwise what they will think that I don't have gastric problem earlier, after taking homeopathic medicines I got this gastric complaint. Okay, so many patients will come to us that, doctor, I don't, for the last 40 years I don't have a gastric problem, but after taking medicines I had, for the first time I had gastric problems. They will explain like this. So while we are asking to them, we will read that they have taken in a larger amount. Okay, so vitamin E is also, we take vitamin E. Then zinc is very much necessary for the reproductive health. So either a supplement or I that is zinc, which I mentioned earlier. Actually, that is a very good supplement only. And why these people are going behind all these familiar supplements is that is from the modern medicine supplements is more, if they are taking the generic medicines, actually they are cost effective. That is the main reason. And so while comparing with our medicines or some other medicines or the newly updated marketed products. This is the reason why, while I think this is the reason, while I'm absorbing all these things, they'll get a strip for 100 rupees or 75 rupees, 30 rupees, like that, they will get. Then and over-the-counter medicines is very common in our country. Nobody is asking whatever the medicine. If they are asking that medicine, whether pharmacist or the staff there, they will definitely give whatever things they are asking. So, for these kinds of patients, diet is very, very, very important. Well-selected remedies will also fail. That is because their body is demanding their deficiencies. So we have to take care of all these deficiencies. Medicine is necessary, proper case taking is necessary, proper medicine is necessary. We have to teach them or we have to make them aware what is their condition, what are all the things we have to do, that is necessary. Then after we have to give restrictions, depends upon the medicine, what medicine we have given. So like that we have to use our homeopathic diet and regimen must be given. Like the same way we have to give the physical ailments diet and regimen must be given. Then their supplements should be taken. Then so they have a proper sleep, and we have to give them advise them regenerative therapies. If they can do yoga, they can do any exercise. And in nowadays also, most of the persons believing that, patients believing that walking is only for cholesterol or diabetes or reducing fat, for reducing obesity. Not only like that, walking is very much important for our mental health also. That is for our happiness also. If they are not diabetic, we can ask them for taking dark chocolates also. Even a small piece of dark chocolates taking every day will increase their mood also. That thing is also important. Like the same way, whether a patient is coming to us, if he is a believer or a narcissistic or atheist, that is not our cup of tea. But we have to make them that, explain them that the need of a prayer. If they are not atheist, if they are an atheist, they believe in science or they believe in universe. So we have to at least 5 or 10 minutes in a day. They have to do all these things. Okay, and next thing is self-love is very important. We must take care of ourselves. Whatever the positions we are handling, that is different. We have to take care of something, and we'll go to
O-
one or two favorite medicine also. Is it all
Okay,
the time?
Okay, Dr. Rasheed, we can go for discussion. What a brilliant presentation. You really covered almost all part of the Andropause problems, and nobody never thought that so much of content was there in the presentation, but it was full of energy, full of things, and full of everything, one must say, because these are the things usually people believe that these are the things can be managed by uh, men, people from the doctors' fraternity. But as far as you're concerned, we have shown that even a women doctor or lady doctor can do wonders in this field, because people usually people visit to us for some other reasons, but when they come to our clinic, then we may find that there are so many problems with them. They believe that they can it can't be solved, but when you open up with the patient, definitely the patient open up his case and will say that, doctor, I have this problem. I have the I was so much interested in sex, but I'm overindulged in sex like that. Then is it a problem for me? How can it be corrected? Is it a wrong thing? Like that. So there's so many questions they may ask. As a doctor, whether you are a lady or a man, it doesn't matter much. What you have to give the confidence to the patient that what you are suffering is a disease problem. It can be due to some hormonal imbalance. But please don't hide to anyone. You can tell openly what are your problems to me, so that I can solve your problem, or sometimes I can assist you in all these things. You have you really mentioned about the importance of food, the importance of vitamins, importance of everything. So anyway, congratulations. It is the time for discussion. I invite all of you to participate in the discussion. Dr. Manoj is always there to begin the session. Yes, doctor.
Thank you, Dr. Sanesh. And congratulations, Dr. Riji. You have done a wonderful job, because this is a social problem more than the disease, a real social problem. And it is not addressed properly, even though the menopausal syndromes are properly addressed. This andropausal is not at all properly concerned. It's a new, I think, a new branch of medicine. Then what about the hormone lasse? You mentioned about the hormone lasse. What are the hormones to be investigated there? You please mention about that.
Sir, in the hormonal assay, mainly in this type of patients, we have to mention about testosterone only. That is needed. If the testosterone is low only, we can go for DHEA and we can go for estrogen. The whole things can be, we can do.
Okay. Then you
Okay,
mentioned,
and hormonal assay in males, it depends in most of the labs, the profiles are vary from person to person or from the lab also.
okay, then you mentioned about the difference situation these fellows are facing: anxiety, depression, irritability, lack of confidence, memory loss, mood swings. Then you gave a word of caution on two things. One is the social withdrawal. That's a very, very important section, especially the government employees. After
Yes,
50
sir.
or 60, they're often withdrawing from the public social activities. That will be get tragedy in their life as well as their family life also. Those who are depending him. Then another,
Sir,
yes,
in
please.
the case of male, what will happen is because in the case of female, they are surrounded with many and in their chit chat and all the things they can express. But in the case of males, it is very poor. As you
Yes.
said, it's a valuable point.
According to their nature, they can enjoy, but here these poor fellows don't have that facility. Then you mentioned, then give a caution about the protection of patients. That's also an important thing. Especially when the doctor is a lady, it is quite natural. Somebody will come to a clinic and you really cautioned. There's also anyway nice presentation. So don't get frustrated when you are this screen sharing is failing. No problem. You have
Yes,
got
that
the
is true.
ability to write all these things. Congratulations. Thank you.
Yes.
Yes, exactly. That's what is your ability. You have the ability to take the people around you with you, and you are really successful in taking us to with you. And that's what I would like to add to this presentation. I'm inviting Dr. Sunil Raj to say a few words on this presentation. Doctor, please come forward and make your statement here, because Riji is a upcoming
Yeah.
she will definitely achieve a big name in the history of homeopathy also, because she is trying to make homeopathy an impact to with not only simply saying that I am a homeopathic doctor, but she want to say that I am doing something for homeopathy. That's what I must say, because that much of determination in you. A homeopathic doctor can go into such a depth and come out with this beautiful presentation here.
Dr. Dhanesh, let me add one thing. We have a session, the next session, the Malayalam, the medical supplements. In
Yes.
fact, it's produced by our pharmacists. So we want to promote these supplements. So in the coming days, definitely we will arrange an international session also for supplements. What are the supplements produced by our companies, and we must support them. Okay.
Exactly. That's what Dr. Riji Rasheed has mentioned about when she was talking about ashwagandha. She told that you can get ashwagandha tincture, but in the meantime, you can get ashwagandha s- supplement also. Am I right, doctor?
Yes. Nowadays, most of the patients are not interested in taking tinctures. If it is 1x or 3x, they'll be happy to take.
Yes, exactly. That's why the Homeco has produced so many syrup. For example, not like that. The Amlacha syrup. So many syrups are there, but it is not a mixture of any. But so many medicines, but it's only single remedy, a single medicine, and they prepare in that way so that it is sweet. And when somebody is given to the children, they may take it with love and care. Okay. So anyway, it's really a very good session. If anybody want to speak, please raise your hand so that we can allow you to unmute yourself and you can speak to the Dr. Riji Rasheed. You
Dr.
should.
Raji, I think you are alumni of Saradarshan Homeopathy Medical, isn't it? Am I right?
Yeah, actually, I completed my BHMS in White Memorial Homeopathic Medical
Right.
College.
Okay.
Yeah, in Sharda Krishna also I joined for Organ of Medicine PG, but I not completed my PG.
Okay.
So
Yes.
in both colleges I was there.
Pardon?
And in both colleges I was there. I am proud to be talking about these two colleges and from my basis from White Memorial Homeopathic Medical College.
Yes. The next session is taken by Dr. M.B. Ajit Kumar, the head of department community medicine, Saradarshan.
Yeah, he's our unit head. While I was doing my organ medicine, I was inside his department. That is, he's our unit in charge.
Okay.
Yes. Anyway, this Saturday was really brilliant for us in this. Particularly, you talk about sexual condition. That is one thing. You came forward and presented in a beautiful way. But actually, people never thought that this is the subject you are talking about. You are going to talk like that. There were nobody may realize that it is something related to these sexual disorders. Otherwise, sometimes there may be more people of may be attended. Anyway, it is a time to wind up the session. I invite Dr. Ram Paresh to say what are thanks to the session. He's a veteran homeopath from North India.
Thank you, Dr. Dhanesh ji, and Namaskar, Dr. Manoj ji, everyone, and congratulations, Dr. Riji Rasheed. Very nice presentation, dynamic lecture.
Thank you, sir.
Dynamic एकदम excellent session. Deficiency of the sexual disorder, hormonal disbalance, you see. So very thanks. Behalf of IFPF, whole team, very thanks. Thank you, madam.
Thank you, sir. Thank you.
Yes, thank you, Dr. Rampare sir, Dr. Riji Rasheed, and those who attend the session. And tomorrow we will have a session from Dr. Surabhi Soni, and she will be talking about understanding the importance of mind in prescription through case series. So that we can hope another big session coming on tomorrow. Hope all of you will be with us in the evening of Sunday after you're spending some time in your beaches or whatever maybe. Of course, you can study homeopathy along all of us with us. Thank you all. It's
Thank you.
good night. So over to
Very, very thank
Dr. Manoj to moderate the Malayalam session.